So we're gonna get started. Sorry for the glitching. Thanks everyone for standing by while we dealt with that. Just before I kick it off to Richard Lyle, my name's Amina Dib. I'm a Programs and Policy Analyst at RESCON. We have a great lineup for our second annual Addressing Mental Health in Construction event. RESCON will be very active on Twitter over the next couple of hours, live tweeting from the event. And we'll be using the hashtag MHConstruction. So if you want to engage with us on Twitter, we certainly welcome it. And I'll hand it over to Richard now to deliver some opening remarks.
Thanks, Amina, and good afternoon, everyone. I'm Richard Lyle. I'm the president of RESCON, and it's my immense pleasure to be here today to kick off the second annual Addressing Mental Health in Construction Symposium. Just a year ago, we had our first event on mental health in construction. That event was focused on raising awareness about mental health and addictions in our industry and removing the stigma. We have made mental health and addictions a strategic priority. Special thanks to RESCON's Health and Safety Committee for taking leadership on this. On our second event today, while still raising awareness and removing the stigma, it's focused on practical wellness practices that employers can implement in their workplaces. COVID-19 has certainly exacerbated many mental health and addiction challenges that people face daily. It's imperative that the entire construction industry continue to prioritize mental health and addictions and incorporate it into our health and safety strategies. There's a lot of work to be done, including changing the culture on construction sites. We must make our employees feel safe and incorporate it into our programs and policies and make them feel comfortable talking about mental health. Further, compared to other jurisdictions, provinces in the United States, there remains a large gap of publicly accessible statistics and research on the degree of mental health issues and addictions within our industry. I'm hoping this symposium shines light on this problem. I'm honored to introduce our keynote speaker today, the Honorable Michael Tobolo, Associate Minister of Mental Health and Addictions. RESCON applauds the work that he, in particular, his staff, and this government have been undertaking to create a connected system of care with comprehensive wraparound services so that every Ontarian can feel fully supported in their journey towards mental wellness. Since COVID-19 began, the government has greatly improved and increased accessibility and availability of mental health and addiction supports, virtual and in person, for all Ontarians, including construction workers. Minister Tobolo was first elected in Vaughan Woodbridge in June 2018 and has been a staunch advocate for helping those facing mental health and addictions challenges. We are looking further to expand our engagement with the province on raising awareness of mental health and addictions in the construction industry. So without further ado, please help me in giving a very warm welcome to Minister Michael Tobolo. Thank you.
Hello, everyone. It gives me great pleasure to speak to all of you here today in my role as Ontario's very first Associate Minister for Mental Health and Addictions. I'd like to thank RESCON for extending the invitation for being here for the second annual Mental Health Symposium, and I commend the organization for shining a light on the mental health and addiction challenges experienced by those within the construction industry, challenges that are rarely talked about. As many of you likely know, across the province, people are struggling with challenges related to their mental health and addictions. For instance, 2 million people in Ontario go to their family doctor for mental health or addictions-related reasons every single year. The numbers also tell us that nearly 3% of adults and 10% of high school students in Ontario reported using prescription opioids non-medically. While Ontario has been fighting the battle with COVID-19, it's important to remember that before this outbreak began, we were fighting other equally important battles against increased stress, anxiety, and increased reports of addiction and overdose cases across the province. These are battles our government has taken very seriously. Since the start of the COVID-19 outbreak here in Ontario, we have implemented a comprehensive suite of policies and programs to address the mental health and addictions of people and families in the province. We continue to provide several different options for mental health services and supports, which have proven invaluable throughout the COVID-19 outbreak in Ontario. From supports such as Kids Help Phone, Connects Ontario, Bounce Back Ontario, and the incredible services delivered by so many of local organizations that some of you may have already been aware of. We also continue to connect people with drug addiction to treatment and rehabilitation supports by funding 16 consumption and treatment service sites in 9 communities across the province, including Toronto, Ottawa, Guelph, Hamilton, Kingston, Kitchener, London, St. Catharines, and Thunder Bay. Consumption and treatment service sites save lives by preventing overdose-related deaths and help to connect people to primary care, treatment and rehabilitation, mental health, and other health and social services. We've invested over $30 million to ensure Ontarians living in areas with the highest need have access to these wraparound services when and where they need them. With so many people struggling with mental health and addictions challenges in every corner of the province, and with the stigma associated with those challenges, our government is focused on sending out a clear message of hope. For years, Ontarians have expressed frustration around Ontario's mental health and addiction system. Whether it is the widespread fragmentation seen throughout the system or the extensive barriers to access, our government recognizes that this needs to change. That's why, just weeks ago, we announced $176 million towards building a comprehensive and connected mental health and addiction system where every Ontarian can be fully supported. This additional $176 million builds on the $174 million that we invested last year in more funding for mental health and addiction services for people of all ages, bringing new investments across the sector since last year to a total of more than $350 million in ongoing annualized funding. We're committed to addressing the mental health and addiction needs of all Ontarians, whether you're children and youth, those suffering from addiction, involved in the justice sector, or in need of supportive housing and Indigenous peoples. And this is just the beginning. Recently, I was also proud to stand next to Premier Ford in Sudbury to announce an additional $14.75 million invested by our government in making what will significantly expand access to the virtual and online services being used by thousands of Ontarians, including virtual mental health and addiction supports and internet-based cognitive behavioral therapy for those experiencing anxiety and depression. This investment also includes funding to support culturally sensitive services for Indigenous people in Ontario. In addition, funding will be going to address service gaps in the community mental health and addiction sector with a focus on COVID-19 hotspots. Needless to say, this outbreak is almost unprecedented in our province's, our country's history. These are truly extraordinary times. When people are experiencing something new and unfamiliar to them, that can cause many people to experience stress and anxiety, among other mental health challenges. And that is why back in April, our government announced emergency funding of up to $12 million to immediately expand online and virtual mental health supports to improve access to services during the outbreak. We did this because we needed to help the many Ontarians that are experiencing anxiety, stress, or other mental health challenges. Just as importantly, these supports provide alternatives for Ontarians who haven't been able to access their regular in-person counseling supports because they're respecting the direction to remain at home to stop the spread of COVID-19. Thanks to this emergency funding, our government was proud to announce in May the launch of internet-based cognitive behavioral therapy programs. These programs were developed in partnership with Mindbeacon and Murnau Chappell and are being provided at no out-of-pocket costs to Ontarians across the province. Clients can self-refer to programs and be guided through their client journey to find the appropriate supports they need. Online ICBT is also supported by therapists and available in both English and French. These programs have been helping thousands of Ontarians experiencing heightened anxiety and depression during the COVID-19 pandemic, including our frontline healthcare workers. These investments all fall under the umbrella of our government's Roadmap to Wellness, a plan to build Ontario's mental health and addiction system. This roadmap provides a clear path forward, offering Ontarians easier access to higher quality services and supports in communities across the province. Our government is committed to ensuring the roadmap is a success, and that's why we are investing $3.8 billion over 10 years to create new services and expand programs. In fact, we have already started to fill urgent gaps in care that our system partners have identified through immediate investments. We invested an additional $174 million more in annualized funding for mental health addictions programs in 2019-2020. And we will continue to engage with our system partners, including Indigenous communities and other communities with unique needs, to help guide the effective implementation of this plan. The Roadmap to Wellness moves us in the right direction toward building a comprehensive and connected mental health and addiction system that works for all Ontarians across the lifespan. It's a plan that is client-centered, data-driven, and evidence-based. Most of all, it is a plan that will ensure that all Ontarians are able to access high-quality services and supports where and when they need them. We made a promise to the people of Ontario to address the growing frustration with capacity issues within our mental health and addiction system. Through our investments, we are helping those struggling with mental health and addictions to get the care they need in a way that is better integrated and connected to our healthcare system. And we continue to look at ways we can increase funding to address urgent gaps in care and wait times for mental health and addiction services, create new supports, and expand programs. Supporting people facing mental health and addictions challenges continues to be a top priority of our government, and a priority for me as Associate Minister for Mental Health and Addictions. We want people struggling with addiction and mental health challenges to have access to the right services for their needs when they need them. We want them to know that there is hope. We want them to know that the available services and supports have changed the lives of so many people, and that there are always people there to support them on that journey. Only by sharing positive success stories can we give them the hope they need to take that first step, to overcome the stigma around mental health and addictions, and reach out for help. We want all Ontarians struggling with mental health or addictions to know that their government is here to support them. Again, I want to thank RESCON for inviting me to be here today, and I look forward to next year's event. Thank you.
And I would just like to, I'd just like to thank Minister Tabolo for his informative keynote remarks. The minister has shown an incredible commitment to mental health, and he inspired a lot of people on our webinar last year, and he's followed that through, and their government and this government has followed through with massive investments. And we are here, to say thank you, and we are really impressed with their commitment to creating a connected and accessible mental health and addiction system in Ontario. With that, I am going to turn it back to my colleague Amina Dib to introduce the Chief Prevention Officer.
Thanks, Andrew, and thank you, Minister Tabolo. I'm now going to introduce our next speaker, the Chief Prevention Officer for the Ministry of Labour, Training and Skills Development, Ron Koleski, who will share details about the occupational health and safety strategy for the next 5 years. Thank you, Ron.
Thank you, Amina. We're just gonna put the Excuse me. Well, thank you, RESCON. Thank you, Richard and Andrew and Amina, and thank you, Minister Tabolo, for those remarks, and appreciate the opportunity of speaking at this second mental health program for construction. I must say, RESCON, I congratulate you on your leadership, specifically the work that you're doing in both anti-racism and mental health. You know, we've done some research. We're all living in a great big petri dish right now with the COVID, but some of the stressors that people are facing right now that are causing you know, widespread mental health concern are things like you know, the workload that people are under, the time and pressures that people are feeling, the lack of influence over their day to day. It just seems that there's a tremendous amount of pressure. People that either have too little because of changes as a result of COVID, or too much responsibility that's bearing down on them. You know, people fears of, you know, lack of training or perceived lack of preparation for the unknown, ambiguity, too many masters. You know, you listen to public health, you listen to the federal public health, you listen to your local public health, you listen to your employer, and you listen to the media. There's so much information coming out. You know, feeling a lack of recognition for the stressors that people feel that they're under. You know, then discrimination, harassment, the normal things that or abnormal things that are occurring at work. And, you know, the feeling that people might be working unsafe, you know, given the changes that are occurring in workplaces today. And then a perceived lack of communication. And when you think about the impacts on mental health, about trying to look after your family, looking at your security of your work under an unknown environment, you know, changes in practices that we're all feeling, and this apparent or belief in a lack of security and knowing what's happening in the future, in the unknown. So these are all things that are happening, and I think, you know, when we started looking at construction, there is an evolving strand that, you know, anxiety and depressions within the construction industry have overtaken, you know, musculoskeletal disorders as the most reported workplace health and safety issue in construction. And this, as the minister indicated, and as Richard had noted, you know, we're trying to get more evidence on a North American perspective, but certainly what they've seen in the UK has some very disturbing trends. And, you know, it could be described as not just a silent epidemic, but an invisible health hazard. And when we start looking at the implications of mental health, we know that 60% of physical injuries have a mental health component. We also know that when one is distracted, whether it's their mental well-being is a challenge, that there is a resulting increase in injuries, a resulting increase in conflicts. You have immunity issues. You can have substance abuse. So it's an ever-present conflict that we need to start addressing. So the image that persons that continue to surround construction can make individuals reluctant to speak out due to the risk of being stigmatized. And this is very common. We saw that in our efforts to start to address post-traumatic stress within the public safety area, where you know, suffering in silence had been the norm. And it took a tremendous amount of effort to get people to come forward. So we want to ensure that construction persons working in construction have access to resources that are available, both anonymous and other. And noting what the minister had indicated about some of the virtual programs that are available, specifically through Morneau Chapelle and Beacon. And I remember, you know, 5 years ago when the concept of a no bricks and mortar psychological support service came to light, that people were somewhat skeptical, but this is becoming the norm. This is becoming easy and affordable to employers across across the country to have access to things available and anonymous to their workforce. Next slide, Amina, please. So the occupational health and safety strategy for the next 5 years is focusing on obviously a reduction of fatalities and workplace illnesses. And we are moving towards more of a public health model that follows what the minister had indicated, that is evidence-based, measurable, and outcome-focused. And this strategy has been about 2 years in the making. We would have released it before COVID, but we felt that we wanted to learn a bit about COVID before we did so. Next slide. So we have 4 pillars that we're moving towards, and those 4 pillars are moving to the public health model through the best evidence and performance measurement. We want to look at how we transfer knowledge and how that knowledge is translated. So improving the methods of training and knowledge and practices, support our workplaces to fulfill occupational health and safety roles and responsibilities to achieve excellence. So this is the support of business. And then the 4th one is making OHS easier for small business, recognizing that 85% of Ontario businesses employ less than 49 people. And the overarching component of the strategy, aside from the 4 objectives, there are 25 activities that fall under these 4 objectives. But most importantly, the focus will be on occupational disease, occupational injury and traumatic fatalities, but workplace mental health and workplace violence and harassment. We want safe environments and we want healthy workers. So we hope to be releasing this strategy in the new year. You will find it'll be a very simple document, very straightforward, 12 pages long, very graphic, and very results oriented. So it's really a collaborative effort that really redefines the health and safety system to include all workers, WSIB, our health and safety partners, the private sector health and safety, our inspectors, and certainly large employers and employers that are participating in any one of the incentive and recognition programs that we're moving towards. Next slide. During COVID, we've developed a number of tools and resources available to people, mental health supports during COVID-19, various different programs and services that are available. We recognize that even in the normal circumstances where environments have stress, you add something like COVID, then that only adds to the mix. So in the back of the presentation, I've left you with a number of links and services that are available that you could take advantage of. And the health and safety system is constantly develop new programs and services for small businesses, and we will continue to do so. Next slide, please. What can we do? Well, the second semester is a great step in continuing the efforts to inform and to act. It all started for me with post-traumatic stress 35 years ago, and it was an iterative process of getting people to adopt and recognize PTSD. There's certainly been a huge acceleration in the last 5 years since Bellette's talk, where there's now a normalization that mental health is a reality. 30 years prior to that, we were still working against the stigma, but now those opportunities to have a conversation and normalize this is occurring. Resources are available through a number of venues, and particularly in construction. Infrastructure Health and Safety is working closely with the WSPS, the other health and safety partner, to co-develop resources available for the construction industry. And really, we need to work with construction to understand what is needed. part of the strategy is to look at how we translate and how we transfer knowledge, knowing what the industry wants, knowing what the industry needs, and knowing the best way to present that information so that it is absorbed by the people and audience we want is going to be really important for us. Sometimes in government, we create the most convenient way to communicate with people, and at times we miss the very people that we're trying to communicate with. So it's very important that we know what is required and how best can we deliver it. I would say, if I had one suggestion for the construction industry to start the process or continue the process that we're on, it is really start to focus on your supervisors and to bring this up during the morning toolbox talk, talking about what resources are available, making available pamphlets, saying it's okay to come forward and speak to somebody if you have a concern. And then, if necessary, looking at organizing peer support groups so people feel that they can go to someone that's a colleague or a peer and discuss their concerns. I think I mentioned last year when they did the UK study that they found that the families of construction workers used EAP more than the construction workers themselves. But I think I applaud Richard and RESCON for continuing this process, and I'm sure that we will have more informative sessions going on. And I would like to wish everybody a good presentation. And as indicated, there are links contained in the back of this presentation. So I do have to step off to go to another meeting, but Amina, if there are questions in the chat box, please by all means just send them to me and I will answer the questions and get back to you. Thank you very much.
Thank you, Ron, for detailing how the Ministry of Labor Training and Skills Development is incorporating mental health and addictions into their overall health and safety strategy. We'll now hear from Cal Bayer, who is the Vice President of Workforce Risk and Worker Wellbeing at CSDZ.
Thank you very much, Amina, for this invitation to join you today for the second symposium. I've been following very closely what RESCON is doing. I also applaud you for your efforts not only on mental health and substance use, but the efforts around racism in the construction industry. Your organization has taken a strong position on both topics, and it's a pleasure to be with you today. I am from the United States, although I feel like I'm an honorary Canadian. I met my wife and had our first date in London, Ontario now, many years ago. And I traveled through your beautiful province, many different cities, as a member of a group called Up With People, and stayed with Canadian host families, enjoyed my first Canadian Thanksgiving. But more importantly, we're partners in this construction industry initiative around mental health, substance use, and suicide prevention. It's a pleasure to be here. I met Amina after doing a program earlier this summer with the National Association of Home Builders in the United States. And she contacted me at that point. We've been in touch ever since. I called this program Shining Light, and it was excellent to hear the Associate Minister use those terms, shining light, and also with Mr. Koleski as well. But I really appreciate this opportunity to talk about the impact of the pandemic in more specific terms. The pandemic has had a big impact. It's exacerbated the underlying stress and anxiety and all the ripple effects that it's causing in our workforce and our families. Very important. We're going to talk then about why mental health, substance use, and suicide prevention are workplace issues. Historically, they've been taboo, things that we haven't necessarily talked about in the workplace. Third, I'll begin the process of how do we incorporate this through culture in our safety, health, and wellness programs and practices. And last, I'll share with you what's been very effective stigma reduction strategies and some resources, and really invite an invitation to deepen our conversation on these various topics. This topic has been very important for many reasons. On the mental health side, depression continues to be the leading source of disability worldwide, and suicide is an international public health concern. Mental health and substance use, along with chronic pain, traumatic brain injury, sleep deprivation, are among the factors that contribute to individuals choosing to end life by suicide. And there were over 800,000 deaths by suicide in 2018 internationally. And we know those numbers are grossly underreported. Much like our prior presenters, this is a message about hope, help, and recovery. And suicide can be preventable, but only if we talk about it and if we equip people and empower them to get involved in this topic. Everyone has a role to play in suicide prevention. The same for mental health in the workplace and at home, and the same for substance use and misuse. Through our program today, I'm going to use a few directed chat questions, and Amina, Andrew, and I will review these, one as we go, and then two following the session. This is an opportunity for us to share information with your Safety and Health Committee at RESCON. But the first of these chat questions: has your organization addressed mental health and suicide prevention? If you say yes, please share 2, 3, or more examples of how you've addressed these topics in your organization. And if you have not, please share why not. This is important to understand barriers and how we can overcome and surmount those barriers to bring more people that hope, help, and recovery. So please use the chat function. We'll monitor that periodically. Mostly we'll be using that at the conclusion. I'd like to share just a little bit about myself. This is a topic that's been near and dear to me for many years. My first experience with suicide was as a teenager. I saw my mother help a cousin with the loss of a son by suicide. She used her gifts of compassion and unity to bring our family back together, mostly her extended family. She took away the blame by being compassionate. 6 months later, I saw her do the same in our neighborhood as she helped a mother who was a single mother of many children deal with the death of an oldest son. And my mom rallied the troops in the neighborhood and brought casseroles and coffee, cared for that mother for many, many months and beyond. And we learned, don't ever judge, don't know the pain that people are experiencing. That ultimately led to me to recognize I had compassion gifts as well. I worked in healthcare through high school and college. And the one pain that I learned over those many years that we couldn't address was the sting of a death by suicide. And that stuck with me. It was those experiences in an ICU and in an emergency department and also an organ transplant unit where I recognized something needed to be done on a prevention side. So I became a safety, health, and risk management professional. Every job I've had since that time has touched around mental health, substance use and misuse, and suicide prevention. Where I noticed this was moving from the Chicago suburbs to the Northeast pre 9/11. And I saw construction workers among the rubble with first responders. First responders had chaplains visit them at the end of each day, during the day. We saw EAPs assemble and take care of those workers. We didn't see the same services available to construction workers. We weren't very effective at critical incident response in our industry, but we got better. Post-Hurricane Katrina, I was now working for a startup insurance company, and I was teaching people critical incident response, how to take care of people when bad things happen in the workplace or on the job site. And we were working to bring people new tools, new resources. And what happened was I partnered with a gentleman named Bob Vanderpaul. He was then the president of Crisis Care Network, and he was teaching me psychological first aid. In 2008 and 9, we wrote an article called The Critical Human Element of Crisis Management, and that went viral for a safety topic. We started teaching across the country, different insurance groups, different construction industry organizations, even some labor unions. And we saw that there was a need for more. What became powerful was a year later, Bob was appointed to be the co-chair of the National Action Alliance for Suicide Prevention in the US. He appointed me and I was the only non-clinical professional. In 2012, I threw the gauntlet down and said, our industry, construction, has so many risk factors, we could be considered a high-risk population. At that point, there was no data, and it was frustrating. We were trying to apply that public health model, but there was no data. So we did a risk analysis, and we identified the various risk factors. And what ultimately happened in 2014, I went to work for a construction company here in the Seattle suburbs that allowed me to bake mental health, substance misuse, and suicide prevention into our safety, health, and wellness culture. That became a group called the Construction Industry Alliance for Suicide Prevention. That was formed in October of 2016. The first data in the US of suicide by occupation came in July of 2016, and it showed, as we suspected, construction exceeded the average among all industries, including first responders. And this became a tipping point. It led then to suicide prevention summits across the country that allowed us to address mental health, substance misuse, and now even well-being and wellness. On March 16th of this year, I started a new job, and that was the day before most of the rest of the world went work at home and shelter in place. And since that time, I was asked to take care of people during COVID. I've done over 90 webinars for various large associations, organizations, labor unions, and we've been focusing on teaching people how to take care of people, changing culture, building programs and practices so we can avoid some of the aftermath of what we expect from the pandemic. Along the way, my personal experience or my professional passion turned into a personal passion. I lost a dear friend in February of 2015. I learned a lot. One thing I learned is someone can tell you that they're okay and not really be okay. And someone can tell you they're okay, but have many layers of masks. His family, this is Jeff, the big dog. That's a decent fish for the US. I'm sure they grow much bigger in Canada, much like your hockey is better than our hockey. I'm a big fan of that, by the way, but Jeff taught me a lot, and his family boldly professed the cause of his death. His death certificate may have said suicide, but he died by stigma. He suffered in silence, and he was ashamed to ask for help. His family asked me if I ever get a chance to use my voice to be a little louder, please do, so none of us would feel that pain again. Ultimately, within a week, I declared war on suicide. I determined I hadn't been bold enough. I was the guy who talked about mental health in the workplace, but I was afraid to use the S word for suicide. As soon as I framed it as mental health and suicide, people jumped on board. Oh my gosh, I had no idea. How can I help? And it became a safety topic. So because this is a matter of life and death, I like to equip people with tools and resources. The first tool I'd like each of you to do is load in your cell phone contact cards for these two emergency numbers. The first one is a telephone hotline, Crisis Services Canada. It is national, and I'll share additional information for Ontario. But the number is 1-833-456-4566. It's 24/7, 365. With the increased volume of calls, the chat functionality is not active currently. And they do have a limited chat that is from 4 p.m. to midnight. I did not list that because I felt like the phone is going to be a more reliable number. The second number I'd like to give you is Crisis Text Line. And there you can type or text help or connect to 741-741. That's been a powerful service helping people on job sites for many years. I printed wallet cards starting in 2015 to put them out on job sites and to do toolbox talks for other contractors and even associations. And it was a powerful movement of reducing stigma and empowering people to take care of themselves and their families. I'd like to share this information. You'll get a copy of a PDF of this slide deck. There are other local resources, great support available in Ontario, and you can search by every other province in your country. There's good resources at Crisis Services Canada. There's an entire page, it's very robust, of resources in Ontario, various geographic locations. I'm very impressed with the available crisis services. Compared to many of our states in the United States, we just have the National Suicide Prevention Lifeline. So that's a positive for you in Ontario. Because of our proximity, our neighbors here in the US and Canada, you might have operations, you might have people, you might have family. I'd like to share those numbers with you for the US. Crisis text line remains the same. It's the same number, and that's a beautiful thing. They're expanding internationally, and so Ireland is one of their next locations. I'm very excited about that. And then the National Suicide Prevention Lifeline. This is in the US. It's 800-273-8255. In 2 years' time in the US, that will become a new 3-digit number, 988. But for the time being, that is the number for you to share with your colleagues and associates and family in the US. What I'd like to do is ask Andrew to please send out a poll question. We'd love to have your participation. I'm going to do 4 polls, and this is a great way for you to share insight. The first question, Andrew, is what is the biggest barrier to addressing mental health and suicide prevention in your organization? So whether you're an employer,
can everybody see it? Sorry to interrupt.
Yes, it looks good, Andrew.
Okay, sorry, I'll jump out then.
Thank you. And when you get a good response, feel free to kick that out, probably 40 seconds. But what's powerful here, whether you're a labor union or an employer or another affiliate association, this is an opportunity for you to share with us what are the barriers that you've experienced. The first part about changing culture is identifying barriers and then strategizing and overcoming those barriers. And because of this topic being so important and the role that stigma plays, I love to start many presentations with a poll question like this. So you've got 5 options, and I was pretty deliberate in why I asked the questions the way I asked. And Andrew, when you feel like you have an adequate number, feel free to release those results. And then I'll share with you some of the insights that I've seen during other presentations.
So just to let everyone know, my understanding is the polls are anonymous. So we're not checking on who clicked what. We've got 29, almost 30 responses. So far, there is a tie between unsure how employees will receive it and lacking unified leadership support to tackle it, although very close to it is we didn't know where to start. And then a little bit less is didn't know how real the risk is. The good news, I think, is, there's very few people clicking. Until today, we did not consider this a workplace issue. So I think that is very positive to see. So as a last recap, the 2 the 2 more popular ones, it's kind of a 3-way tie between B, C, and D. So.
Yeah, I think that's excellent. That's really what I expected. In many ways, Canada is a leader in workplace mental health. I expected many fewer responses to A. I did expect B because we're still uncertain. How are the employees going to respond? And C, lacking a unified leadership response, are the top 2 answers when I do this, regardless of country. So I think your responses or results were very similar. I'm going to go ahead, Andrew, and move on and close that out. I do want to commend you as a country. You were the first in 2013 to have a standard for psychological health and safety in the workplace. It was something that we reviewed very closely in our work with the National Action Alliance for Suicide Prevention. Our workplace task force really evaluated and considered this is a very powerful tool. It's available to you. Generally, it has not been used extensively by middle market construction companies, but I think it provides a great framework. I cited it recently in an article I wrote in the US and a Canadian association called the Construction Financial Management Association. That article was on mental health and well-being, and they gave me an entire page to profile this particular standard. So again, it's an honor to be here with you today in Canada. You've got a lot of good things going. I'd like to share with you some of the additional observations that I can make. I decided to give you a linkage between Canada and the US with respect to suicide. And again, this is very similar in our countries. With respect to size and scope, your problem doesn't appear to be as large on sheer numbers, but when you look at the same rates, it's a real issue. And this affects us at home and in the workplace and in our communities and society overall. So you'll look at the number of suicides and you look at it by the frequency in terms of number of deaths. In the US, suicide is the 10th leading cause. It's 9th in Canada. That rate per 100,000. And that becomes important when I share with you some data from the construction industry in the US. And the ratios of male to female suicides are comparable. And this largely is viewed as a male issue. And the biggest demographic in both countries is what are called the men in the middle. You define that in Canada just a little bit longer time span than we do in the US. We view it as 45 to 54. And then at-risk populations, your First Nations and the indigenous populations have a high rate. We do as well in our tribal communities, but for us, it's been white males as much as 70%. The important thing here, these are underreported. And then in the United States, we've got large variations by state. I was not able to find that same variation in the Canadian provinces. I suspect, though, it's there. Many of our Western states have a higher incidence in the US. And so that takes me to just a quick recap. 4 major mental and behavioral health differences between our countries. 1, I found that Canadians have been more open overall to mental health in the workplace. I attribute some of that to that psychological safety and health in the workplace standard. 2, better access to healthcare. I listened to your minister or associate minister delineate all the additional investments being made in substance use and in mental health, and I was very, very happy. In our country, we don't have that same commitment to access and affordability for that healthcare. So that does lead a lot of construction workers to not seeking or accepting help. Another difference is fewer firearms in your country to our country in terms of the use of firearms. The state that I live in, 78% of suicides are with firearms. Nationally, it's 51%. I did find a recent article from August that talked about firearms and suicide in Ontario, and I'll share that with Amina and Andrew to forward out. Another difference is less opioid and less controlled substances in Canada than we have in the US. I'm really proud and really pleased to see how your province in particular is taking this on head on and addressing those fundamental causes. Hearing about those consumption sites really gave me goosebumps. In our country, we tell people doing drug testing is not enough. We need to partner as employers and labor unions to focus on education, prevention, addiction recovery, and treatment. That's very important. You have a better infrastructure currently in place than we do. One positive for us is there's more or less reluctance to talk about mental health and suicide prevention hand in hand. Many times folks in Canada tell me that they feel like this should be done by a counselor. We've been doing this as a safety and health and wellness topic, and we've been enlisting a lot of professionals to join us on this journey. I'm really excited to say some of the progress that we've made, and I'll share that with you. But before I do a deeper dive, I'd like you to do the second poll, please. What's the biggest mental and behavioral health issue in your organization? I'm going to list 5 here. It's anxiety, depression, alcohol misuse, opioids and other substances, or suicide risk. There have been some real interesting dynamics since the pandemic. Pre-pandemic, people didn't like to be asked this question. In the States, we talk about dealing with all the elephants in the room. We've tackled mental health now. We've tackled suicide. The hardest one for us was the substance misuse. And so I'm really, really pleased to say many more articles have been written already this year about substance misuse in construction, which is going to help people be able to seek help, help organizations focus more on the treatment and recovery. Andrew, when you're ready and share results like you did last time, that's wonderful.
Yeah, the responses have come in a little quicker.
Good, thank you.
I'm a little surprised, so we'll see if you are, but right now, 60% have said anxiety, 21% depression, 12% alcohol misuse, and 9% opioid. I'm going to end the poll in a couple seconds, and then I'll be able to show the results. Personally, I thought alcohol would have been higher. I don't know if that's just me or if you got any thoughts on that, Cal.
I do, Andrew, and thank you for your analysis. I would say it was August 26th. I was doing a webinar with a colleague for the Center for Workplace Mental Health. I asked that question just as it was, and alcohol for the first time was 35%. I did one this past week for a very large national group in the States, and 45% said alcohol. Historically, that's been our substance of choice. And I really was thanking people for their honesty and recognizing that that is our big Achilles heel when it comes to safety and well-being. So 81% of our respondents today talk about anxiety and depression. I think that's normal. That's your perspective. I think that's a great story because those are challenges that we can offer people more immediate help. And with your access to healthcare, the addressing of waiting times, et cetera, the use of telehealth, you have tools and resources to help address those issues. I think in our case in the US, we waited too long to address some of those issues. Our culture was very tolerant of substance use. But when I look at this, 19% in the alcohol and substance, that's a different story than what we frequently see in the States. But I do want people to be really open-minded to the potential for alcohol misuse to be bigger than showed up today. I looked at patterns in some of the data and statistics that was available. I do feel in the States, I've got a little more drill down data available from our Substance Use Mental Health Services Administration called SAMHSA. And that data allows me to even look at it by occupation. I look at by adults and I look at teenage drinking patterns. They're pretty similar between our countries. And I don't want people to overlook the potential for alcohol misuse. That's kind of my main point there. So thank you for your participation on the surveys. Andrew, you're doing great. I appreciate that. I was really happy to hear both prior speakers talk about a Canadian organization known as Morneau Chappelle. They are an EAP based in Canada, in your province of Ontario. I've been using their mental health index every month since the pandemic began. And it used the period of 2017 to 2019 as a benchmark. And that would be a 0. If there was no increase, the monthly score would be 0. And right now, the mental stress score for September in Canada is 57.1. And that equates to 22% of the population is experiencing more strain and stress compared to the prior month. 8% experiencing less. They pointed out to more reopening of the economy as a factor for that. It was the 6th consecutive month, like the US, where the mental health score reflected increased. And I'll show you the data of that cumulative in just a moment. What was interesting, much like the US in August, construction in Canada in September showed improvement. And so the third best, in air quotes, of the industries that were rated. And that changed for us in September in the US. We went from an improvement to a deterioration. What's really important here with this data is this is Canadian. 4 months in a row, full-time students had the lowest mental health scores. So this is a time, whether you're a parent, a grandparent, a godparent, aunt, uncle, you name it, a coach, a youth leader, be especially patient, especially gentle with children. And these young adults are really at risk. Their worlds have been thrown upside down. It's topsy-turvy for everyone. So what I'd like to just show quickly, this is a really good resource. It's Canadian data. They do it for the UK, Australia, US, and Canada. This will show you month by month overall score. That's for your country. And then by province, they had this data. You in Ontario are this dark blue line, pretty steady until a slight improvement. You operated in a very narrow band, not a lot of ups and downs, but pretty intense level around that 10 range. So that would be pretty similar to what that current month score was. But what was interesting, this is for Canada overall, cumulative mental health stress. And that is the impact of 6 consecutive months of rising strain. This is from work at home, shelter in place, governmental orders, shutdowns. This is also the effect of hybrid schools. This is the impact of working at home and having students at home. There's a lot of stress and anxiety that's affecting households. There's a couple of factors that I felt were really important for us to do a deeper dive that deal with the construction industry. And so a couple of those factors that I want to highlight, this will show you construction. So you do see improvement. Actually, your country's overall stress for construction was better than other countries. And a part of that is because we've been essential and we've been open longer. We've been able to minimize some of that disruption. But what's important is to think about the blending in our families, in our homes, of the support that we have. People could be experiencing more stress. But the factors that really, to me, tie back to construction are really important to consider. The folks with the lowest mental health score have been those reporting the most loneliness. And this was surprising. Many people felt elderly would have the lowest mental health scores. We've done better among elderly than we do among younger. Younger generation, that social connectivity is so important. And there's further isolation with video and other activities that they participate in. So that's a real factor. Paying attention to those workers who appear isolated, who appear to be lonely, who've had their personal relationships disrupted. That's got to be a focal point for all of us in construction. And secondly, the financial issues continue to compound, the uncertainty, hours being cut, salaries being reduced, hours worked being minimized. Folks without emergency savings have lower mental health scores than those with emergency savings. And it was pretty significant. So apprentices who maybe aren't accustomed to putting money away at a seasonal layoff or a end of project layoff. These are areas our industry is going to have to do a better job on. And those are just a few of the things I wanted to focus on. The scores for women were lower than for men overall. I mentioned older adults had higher scores than younger adults. But the other factor was the presence of children. Having one or more children decrease those mental health scores. I think that's the anxiety of parenting and trying to work at home and trying to deal with all the other pressures of the pandemic. The topic about racism that RESCON is doing, Non-white populations in Canada were deemed to be more at risk with lower mental health scores. The lowest among the races listed was Black at minus 19.5. So I think it's just really important to recognize, acknowledge, and then address these various factors. If I had to summarize that report, the bottom line was mid 30s to high 30s, people more mentally and physically exhausted, feeling less motivated, and experiencing more overall anxiety and having difficulty concentrating. So that's a lot to take in. And when you think about it, some of our best clues on job sites have been the nonverbal. We've had the opportunity to see people, the physical distancing of minimum 6 feet and more in some cases, having face coverings keeps us from being able to really read people. Since this early summer, we've been spending time teaching people how to connect with workers, both in the office, virtually, and especially on job sites, to help them deal with all these new stresses. And what I would say is warm-up exercise programs, safety stand-downs, doing more frequent toolbox talks, expanding who's leading those toolbox talks are among the techniques that are helping. But another technique has been reframing, asking people to share something positive in their life. And that's been a powerful way for us to reframe this as a positive safety topic. So when I look at this second chat, this is really important. We'd love to hear from you if your organization has had success stories on how you've stayed better connected during the pandemic, office and virtual workers, or on job sites. I gave you just a few, and I'll be happy to share with Andrew and Amina other examples that people have shared with me. There's powerful ways of reframing this to bring people that hope and to let people know we're in it together. And we do that by being empathetic and to provide reassuring language. And that can have a powerful impact on the well-being of our workers. So when I think about the culture change that's necessary in construction, I used a book for that construction company I worked for called Safety 24/7. It was a book about a journey of a company toward exceptional safety culture. And it was also a journey of an individual safety director to better understanding the move from compliance to behavior-based safety to true cultural transformation. What I loved about this book is it personalized safety, and it allowed us to teach safety in different dimensions, not just at work, but at home and in recreation. We use the phrase work, home, and play. And as we were successful at teaching people well-being and wellness strategies, focusing on occupational health, not just their physical safety, we were seeing changes in behavior. People were sharing how they were having their children wear hearing protection on ATVs. And when they were at the firearms range or they were out hunting, people started bringing us examples of wearing safety PPE while they were working in their yards, when they were working in their shops, and especially if children were available. We had some great stories of grandpas and grandmas saying how their grandchildren had corrected them about needing to wear a safety belt before they operated a piece of equipment or a vehicle, and especially wearing PPE when they were at home in their garage or shop working on equipment. The beautiful thing about this book is it made safety a personal responsibility. We appealed to the professional competency of these professionals, and we asked them to take personal responsibility. The most powerful thing, though, is it taught a culture of being my brother and sister's keeper. The crew accountability of people recognizing we are in this together and we owe it to one another, and my safety hinges on your safety. These are things that we intuitively know and we expect people believe, but this book gave us a way with 700 employees in our company to teach it and to bake it into our culture. The book went wildfire, and every new hire in that company still receives a copy of that book. And it's been a powerful testimony. I have no interest in that book, no financial interest. I share it as a way of transforming cultures. We started teaching people role playing. We started teaching people how to talk to their peers about support. And the focus became, it's not enough to get people back home safe at the end of a shift. It was more important to get people back to work safe from home. We talked earlier about those who suffer in silence, and that was the powerful message. The people who suffer in silence because they don't have support, because stigma keeps them from speaking up and seeking and accepting help, they were risking slipping through the cracks. And I wanted to share that reframing, not only of safety and the next frontier in safety of mental health and suicide prevention, but reframing this to real personal well-being, caring at the individual level, no person left behind, getting those people the help that they need and can benefit from. So these are some really important statistics. They cut across many societies, many countries. Generally, it's viewed that we already have a workplace mental health issue because 20% of adults will experience a diagnosable mental health condition in their lifetime. The ones that we see are most prevalent are much like your survey responses, the anxiety, depression, and then substance use disorders like we've talked about today. Untreated, those can lead to ripple effects like suicide. So it's very important. They can also lead to disability through chronic pain and many other factors. That has an impact on quality of life and longevity of life. And those who suffer from those ailments, those conditions, really are significantly impacted. So I'd like to suggest by doing this in the workplace, we're focusing this upstream. We're finding pathways to recommend people and soften the path toward early intervention. It's been well studied in many countries, our two countries alike, US and Canada, up to 80% success of people getting help with that early intervention. That's why this is so effective as a workplace topic. And here's like the last area that I really want to focus on about why this is a workplace issue. It's been studied internationally, not just in the United States, that it's time to rethink and reframe safety yet again. It hasn't been enough to have a reduction over the past 2 decades in non-fatal injuries. We haven't had a corresponding decrease in what are called serious injuries and fatalities. So primarily, I'm a safety, health, wellness, and risk management professional. And those serious injuries and fatalities make us all wonder. Our companies have invested more in training. Our labor unions doing more in the apprenticeship training program. Why are we not seeing a corresponding reduction despite big investments in the cost of compliance and the cost of prevention? What's going on? We ask the question, what's under the hard hat? We want to understand what's going on in the mind of that worker at the time training is not enough, or complying to a policy is not enough. Are they distracted? Both prior speakers talked about distraction. Our industry focused a lot on electronic distractions, cell phones and other technologies. Some companies going so far as to put blocking technology to stop cell phones on job sites and in vehicles. It wasn't enough. We recognize more fundamentally, is it distraction from mental distraction? And are we not focusing enough on the interface between physical and mental health? And so those two are tied hand in hand. And it's very important for us to consider new strategies that will allow us to focus on reducing what's called presenteeism. Presenteeism, many HR professionals, human resources, have focused on engagement. When workers are at work but not fully engaged, or they're detached. There are many reasons for this. It could be worry, it could be anxiety, it could be an underlying mental health condition. It could be a hangover. It could be the lingering effects of substance use and misuse. It could be guilt. It could be worry about a family member, especially here during the pandemic. But the impacts are worse than lost productivity. That's where most of the emphasis has been. Here's what we're seeing and here's what we're hearing. These distractions where we lose focus, increasing near hits, rising numbers of serious injuries and fatalities, impacting quality, defects, leading to more rework, and many other factors. Issues that lead to dissatisfied owners because of schedule delays, sequence delays, and ultimately for companies, profit fade from increased overtime, increased equipment utilization, equipment damage. Many of these factors have to date not been measured. I'm sad to report there's not a study that shows this impact for construction, but we're looking at doing a survey in the new year to better analyze these types of factors. Now, in the United States, this has led to our industry, construction, having the most suicides and the second highest rate of suicides. For us, this number we know is underreported, but 45.3 per 100,000. The rate in Canada is about 11, and the rate in the US is about 14 per 100,000. So this is for the construction industry, and it was for the United States. First released in July of 2016, it was reiterated in 2018, and this year, January of 2020, we got detailed data by occupation, which we call trade. But ultimately, it's estimated that there were about 5,500 suicides in construction, and that's more, many times more, than the number of people who die from occupational fatalities. It's no longer acceptable, is the only word I can think of. It's no longer acceptable to not address this as a safety topic. Now, here is the next piece of data. Again, US data. I could not find data similar for Canada, but these were the top 9 trades. And you'll notice these were the ones that were above that 43.5. That 43.5 was blended for male and female. If you looked at just male, it was just under 50. And so that is a real data. We've got an industry with high data. Now we have specific occupations. When I look at the occupations, a lot of heavy manual labor, very tough physical work environments, tasks and jobs that are physically demanding, large degrees of soft tissue injuries, those musculoskeletal disease, chronic pain, which can lead to opioids and other pain medications. It also can impact people's sleep and quality of life. So I don't share this to be an alarmist. I share it to be a realist. Next week in the US, the Iron Workers Joint Labor Management Initiative has asked me to do a presentation on creating a caring culture. And we're going to be providing information on how to build this culture through programs and policies and practices that will help employees seek and accept help. Please join us. I'll send that information to Amina to share with all of you who've attended. It will be a fundamentally different program than today. So Andrew, this would be the third poll. I just would like to get a sense if our audience knew before today about these statistics. And I'd like them to share their reaction to the statistics. So it's one question with 4 responses that combines both of those dimensions. One is not aware of the statistics and shocked, not aware of the statistics but not surprised, aware of the construction industry statistics but not the trade data, and aware of both the construction and the trade data. Since November 1st of 2015, in the US, we've had over 225 different articles written in various trade publications. So we've been sharing that data. Some of those publications cross over into Canada. And one of my stigma reduction techniques I'm going to cover for you is partnering with your publications to share information. And so I really want to see your results. And Andrew, you've done a great job. When you're ready, let me know. I'll stop talking so you can jump in when you're ready.
Yeah, so this one is a little less answered,
Okay.
but we'll give people another second or two. So 52% said not aware of the statistics, but not surprised. That's followed by not aware of the statistics and shocked. And then third is aware of construction statistics, but not the trade data. So I'm going to end the poll now so everybody can see it. Now everybody should be able to see that, and I
Great.
will turn it back to you.
So again, I think this is a symptom that not enough of the publications are crossing over from us in the US into Canada. We need to find pipelines to share that data. And until that data is available through a study like our Centers for Disease Control, you can rely on that data. That should be fairly accurate because the risk factors are fairly similar. There will be a global summit. It will be a town hall. I'll be representing the US. We'll have someone from Mates Construction from Australia and 2 representatives from the UK that have been invited to present on December 8th. And this would be another opportunity for us to partner with you in Canada, specifically here in Ontario through RESCON. So Andrew, thank you very much for that. That was very instructive. In your PDF that you'll receive, there's going to be risk factors. I've only listed a couple with these little red asterisks that really are US specific data. But regardless of your country, the risk factors remain the same. One thing that BC WorkSafe did very well, in the United States, we've been using their work on anti-bullying. They had a 10-part video series. So I did want to call that out. It was very useful. The work our industries in many countries are doing, diversity, inclusion, and equity, that's going to continue to build respectful workplaces. But you look at industry factors, you look at company factors, and then job, task, environmental factors, and then worker lifestyle. And some of those are personal choices that are made. So my plan was not to cover those in detail today, but to have you think about those. Throughout the year, I do public workshops where we talk about the risk factors, and we'll spend an hour digging into those. We also do a program in either 60 to 90 minutes when and how to talk to construction workers about mental health and suicide prevention. Not enough time to do that today. My job was to frame this in terms of what can you do. Now, what's important is understanding each person is going to manifest differently, mental health and substance use. So there will be physical signs, these psychosocial signs, and behavioral signs. It's no easy task. The goal is not to educate you or your supervisors to be clinicians. The goal is to make this safety so you can have conversations about well-being. And understanding those warning signs of stress and understanding the risk factors is an important part. So the next chat we'd like you to participate in, give us specific examples of wellness and health programs that you've rolled out to impact employee mental health and physical well-being. Could be a warm-up exercise program, could be a nutrition program, many, many factors. And again, I'll work with Andrew and Amina to share some of those. Again, in 2014, I went to work for that construction company. I had the vision of baking this into safety, health, and wellness culture. By May of 2016, a business publication called Forbes published this article, What Construction Workers Could Teach Other Workers About Mental Health Awareness. And that led to us doubling down our efforts. We created that Construction Industry Alliance for Suicide Prevention. So I'll want to share with you a few tools. I'm going to move a little bit quickly because I want to share with you some of the stigma reduction strategies. But 3 keys for leadership support. And those V's are visible, vocal, and vertical, up and down that organization chart. And look for individuals who can share, when they're ready, lived experience of mental health, of substance use or suicide. Those will create the empathy that will turn this into a peer-to-peer program. Those are the most compelling stories. I'm not going to cover this today. It'll be in your handouts because it's a follow-up. But psychological safety has a tremendous impact. And this is when people feel accepted. It's the framework for peer-to-peer. It's the framework for cultural change. It's what that book, Safety 24/7, allowed us to do, is build a common ground and a common trust. And there's business benefits to addressing psychological safety in the workplace. The best study of this is a 1999 book by Harvard professor Amy Edmondson, and she also has a book called Fearless Organizations. But the Google study called Project Aristotle outlines these findings very, very clearly. Your most effective leaders and your most effective teams share psychological safety at the core. So Andrew, this 4th question is just really quick. Does your organization have an employee assistance program? And I'll come back as you do that. But this is an underutilized tool. Again, that company Morneau Chappelle, based in Canada, is an outstanding example of a full service EAP. And they've got great services available, as I've seen. What I'm going to do in the few minutes that remain is share with you some of the stigma reduction strategies. I've also put an appendix in place that will be additional resources. It will include things like the Canadian Mental Health Association, and it's going to share some additional resources from a group called Workplace Mental Health Strategies. That's affiliated with Canada Life. So those will be at the end of the presentation. I wasn't planning to cover those in detail. But this is a really important issue. I frequently find as many as 30 to 35% of construction companies don't have an EAP or aren't sure. And then secondly, we're not promoting this EAP strongly enough. So Andrew, when you have results, I'll wait for them.
Yeah, so we've got some results in as they're finally coming in. I think this question's really interesting. In our first mental health symposium, part of it was in education. And so we have most people on this call are unionized and most are unionized by LEUNA 183. A shout out to Sandro and Lisa from the training center. And I think there are some other LEUNA representatives on this call as well. So thank you for joining us. Part of what we did last year was we wanted to educate employers about what benefits are available to them and to their unionized workers, because through LEUNA Care and jointly trustee labor management funds, we do have EAP programs. So to get to the results, the number one answer at 70% is yes, it is embedded in our employee benefits programs. So that's good because we knew what the answer was before we started. Yes. And it's good that people are recognizing it. But I'll end the polls and I'll share the results. But yeah, 70% yes, and yes, it's embedded in our employee plan. And then other ones, yes, it is a standalone EAP and we pay for it separately. So yes, almost 80%, which is great.
And that's the power of what you're doing at RESCON, is making this joint labor management, taking away the friction, bringing unity, and solving those issues jointly. That is the answer we were expecting. So I greatly appreciate that. You'll have additional information about EAPs in the appendix, including that last 5-item knowledge check. If anyone's interested, I can provide a 15-question, more detailed analysis. These are some of the publications that we've been using. here in the United States. Some of them do cross over into Canada. We welcome your participation. If people want to learn more, let Andrew and Amina know, and we can share with them some of those contacts. This website is called mantherapy.org. It's also used in Australia and the United States. This works very well with our demographic. It was built with the construction industry in mind. There are videos available, there's self-help checklists, and there's various assessment tools that are available. We use them when I worked for the contractor to build this into toolbox talks. We built it into our divisional safety meetings to just share with people that we were going to talk about those items. www.mantherapy.org. Here is a resource, 9 free suicide prevention videos, a group called Joyages, and you'll get those at joyages.com/construction. 2.5 minutes to 4 minutes in length, and it's a great place to share with supervisors who want to learn more about the sensitivity of dealing with that very sensitive topic. I do a blog about every 7 weeks. You'll see some of the topics are very similar to what your associate minister said about the invisible construction crisis. And that's where we share information with organizations. We want you to use those. Feel free to share. They're always been useful. And this is still underutilized in the area of mental well-being, substance use, and suicide prevention, wallet cards, and hard hat stickers. We print shirts and jackets for many jobs, but we haven't done enough in this area. And that black section in the middle with the wallet cards is another example of tools that can help reduce stigma. The last tool I'd like to talk about today is the Construction Industry Alliance. The website is www.preventconstructionsuicide.com. And you'll find various resources, toolbox talks, posters, videos, many different resources. And I'll give you those example of some posters. There are different posters available, predominantly English and Spanish, but you'll see gender and racial diversity in those posters. So to finish this as a topic of hope, help, and recovery, I just want to introduce you to a gentleman named Kevin Hines. 20 years ago, he survived a jump from the Golden Gate Bridge. When people talk about individuals who attempt suicide being weak or selfish, they don't know Kevin. One of the strongest people I know and one of the least selfish individuals. This video here is a 5-minute version of his personal story. And that website that's listed shares hundreds of resources, including videos. These are very useful in your training programs, very useful in your home. It's not uncommon with an audience like this, if people went and shared this with a loved one they're concerned about, for people to actually seek help. And so I've heard hundreds now of individuals that have found inspiration. And being consistent with our message of hope, help, and recovery, I felt that would be a great place for us to stop. So what I'd like to do is I'll give you my contact information. If I can help you or your organization better address this topic in your company, don't hesitate to reach out. But thank you, RESCON, for the opportunity to share with you about mental health, well-being, substance misuse, and suicide prevention in construction. And I invite Canada and Ontario to join forces with us in the US to continue to tackle these topics. Amina, I'll hand this back over to you for the last speaker.
Thank you, Cal. Your presentation highlights the importance of having publicly accessible and up-to-date statistics and research on the state of mental health, suicide, and addictions within the construction industry and from a regional perspective. I'll now turn it to our final speaker, Chad Pearson, who is the Director of Business Development at Plexus Software. He will take us through practical wellness exercises that employers and employees can implement to improve mental wellness in the workplace and beyond. Thank you, Chad.
All right. Thank you, Amina and Cal. Thank you very much. I'm just going to share my screen here and make a small adjustment. Okay, excellent. Cal, it was awesome as usual. Yeah, for those on the call, Cal and I know each other. We ran into each other in a similar presentation several months ago, and it's been an outstanding relationship. He's always just a breath of information. Now, before I introduce myself, I'd like to introduce this acronym beside me. Let me see, I feel like a weatherman here. Okay, perfect. VUCA. Now, VUCA stands for volatile, uncertain, complex, and ambiguous. And it is an acronym that was born in the military to characterize challenging scenarios that had a high risk of death, bodily harm, or severe mental trauma. Now, as I say that out loud, you're probably thinking that it sounds like everyday society or our mainstream or everyday in our mainstream world. And you are absolutely right. So no longer is VUCA a term that is owned by police and military. And that's just the nature of our world and the way that it's going today. And now COVID has absolutely exacerbated the regular everyday stressors that we are being bombarded with. Now, before I think one of the best ways that I can think of to kickstart this seminar, which is going to be a little bit different than what you're used to in terms of performance and mental health, is with these two short videos. Just pay attention as I play these. And I got a real important point coming after them. Hold on.
Do it, bring it up hard and bring it down fast. Hard and fast. Let's go, boy. Don't fall. You gotta stay on your feet. Don't fall. Go straight through. Back up. Make it fight. It's a good one. Now hit it hard. Hit it with the heel. Hit it with the heel. You're not listening. Hit it with the heel. Yes, you can do it. Come on. Yes, you can do it, but you gotta do it this way. Look at me. You have to hit it hard, though. You cannot hit it light. You have to hit it hard. Go. That's not hard. You touch it. Come on, baby. Come on. Up in the air. Look, you can do anything, boy. You can do it. You can do anything. Come on. Hit it hard.
I know it's
I told you could do it.
emotional response, doubt, and then defeat. And then someone came along, took control, helped navigate, and they got a positive outcome. Now, again, I know it's a child, but watch the second video. We're going to tie everything together here.
Do it, baby.
Me, you can only give our guys
This is
45 hours.
13. So for those of you who
Brings
don't
them
know,
to about there.
1970s space flight where an oxygen tank failed. And this
Gentlemen,
is an
that's not
accurate
acceptable.
representation of what happened.
Gene, you gotta talk about power here. Whoa, guys, power is everything. Power is everything. What do you mean? Without it, they don't talk to us, they don't correct their trajectory, they don't turn the heat shield around. We gotta turn everything off. Now. They're not gonna make it to re-entry.
What do you mean, everything?
With everything on, the LEM draws 60 amps. At that rate, in 16 hours, the batteries are dead, not 45. And so's the crew. We gotta get them down to 12 amps. 12 amps? How many? You can't run a vacuum cleaner on 12 amps, John. You gotta turn off. We have to turn off the radars, cabin heater, instrument displays, the guidance computer, the whole smack.
Whoa, guidance computer. What if they need to do another burn? Gene, they won't even know which way they're pointed.
The more time we talk down here, the more juice they waste up there. I've been looking at the data for the past hour.
That's the deal?
That's the deal.
Okay, John. Minute we finish the burn, we'll power down the LEM.
All right.
Now, in the meantime, we're gonna have a frozen command module up there. In a couple days, we're gonna have to power it up, use nothing but the re-entry batteries.
Yeah, we've been tried before. Hell, we've never even simulated it before, Gene.
Well, we're gonna have to figure it out. I want people in our simulators, working re-entry scenarios. I want you guys to find every engineer who designed every switch, every circuit, every transistor, and every light bulb that's up there. Then I want you to talk to the guy in the assembly line who actually built the thing. Find out how to squeeze every amp out of both of these goddamn machines. I want this mark all the way back to Earth with time to spare. We never lost an American in space. We're sure as hell not going to lose one on my watch.
So what you saw there.
You can only give our guy.
So what you saw there was adults, onset of pressure, emotional response, doubt, defeat. And then someone came along, took control, helped navigate, and they got a positive outcome. Reality is, it doesn't matter if you're 8 years old or 80. It doesn't matter if you're a kid in a karate class or if you're saving 3 Americans in space. It doesn't matter if you're solving a problem with your spouse at home or with coworkers at work. Our brains react exactly the same for all of us in all scenarios. And it comes down to 2 parts of the brain, the limbic system and the cortex. So now what today's course is about elite performance during chaos and critical stress. Obviously very relevant for today. Now, my name is Chad Pearson. Why am I teaching this? Well, my story starts with me as that small, skinny kid that was bullied all the time, and being from a police and military family, I was kind of encouraged to stand up for myself, even if it meant getting hurt. And that led into me getting on the wrestling team when I was 8 years old. Fast forward about 35 years, I ended up spending decades in the combat arts, had a career in law enforcement, specialized in crisis resolution. And during that time, I had the privilege of being surrounded by some of the best coaches, some of the best police and military leaders, and some of the best business mentors, especially when I made a transition from law enforcement to construction software. So really weird transition at the end, moving from law enforcement and combat arts into the construction industry, but I would have it no other way. And when I take my experience dealing in VUCA scenarios, the volatile, uncertain, complex, and ambiguous environments that I lived in since I was 8 years old, and I was surrounded by with the police and military family that I was a part of, the parallels with the construction industry are uncanny. So yes, you can go to work and there's a high risk of death and injury. With the pace that the industry goes to, there is such little time for your own physical and mental health. And that's where things really start to degrade. Now, the tactics that I learned from the network of people that I was around through these decades are absolutely phenomenal in the business world, especially when you apply them in the construction industry. Now, I teach a 7-week course on this at my own company, Plexus Software. And it's hard to squeeze enough in. However, what I've done here is I've taken enough of an overview to give you a little introduction into the brain, why it acts the way that it does under pressure, how it impacts our performance, positivity, and mental and physical health. And we're going to finish off with some tactics that you can use yourself and that you can apply to your team and also use with your loved ones, which will help you both become the best version of yourself, but recognize symptoms and struggles in others and help them overcome those struggles. So that said, let's get into the brain. There are many parts to the brain, but what's important for this discussion is the limbic system and the cortex. So you're going to hear me say that over this seminar. So let's just break it down. The easiest way to think about it is the limbic system is your emotional brain and the cortex is your thinking brain. Now, what's important here is that the limbic system was designed way back millions of years ago. It evolved around an ancient hellish world where our ancestors were struggling to avoid murder, sexual assault, and being hunted. That was pretty much their day. And that resulted in the freeze, flight, fight response, which almost everybody is aware of, but there are a plethora of other responses from our stress response system. And this is all coming from the limbic system or initiated from the limbic system, which doesn't mature past 2 or 4 years old. So for many people in mainstream society, one of the best examples I can think of when you're in or being ruled by your limbic system is when you're in an argument with somebody or your spouse and you're saying a lot of silly things. And when that person accuses you of acting like a child, they're kind of right. Yes, you're an adult, but you're using a portion of your brain that stops maturing after 2 to 4 years old. And then when you get time and distance between you, you're probably thinking of all the amazing things you could have said in the argument. That's because you made the transition back to your cortex, and now you're performing with all of your wits about you, your skills, your talent, your experience. Everything that you have learned in life is in your cortex. And when you are in your limbic system, you don't have access to those. So small things like when you're doing a presentation and you get dry mouth, that is a limbic response. There's a whole bunch of them, but we're going to get into a few of them in a bit. But first, I want to talk about the impact that it has on mental health, as well as positivity, performance, and our physical health. This graph behind me, if you look at the red area represents stress. Now, what's really important to know is that our ancestors who were living with the limbic system before the cortex even evolved, they suffered 2 to 3 critical stress incidents a day. And the critical stress response was designed to keep them alive in that hellish world. But what's happening now is our own intelligence from our cortex is making it very difficult, because the same critical stress responses that were used to keep our ancestors alive is the same stress responses that we have, and that our brain initiates to the inconveniences that we experience. So we've become so smart, but our cortex is really bad at recognizing what true threats are. So what happens is we might be worried about being late. We might be worried if our coffee was too hot. We might be worried if our coffee was too cold. We might be worried about something legit about, our mortgage. All these little minute micro threats to our convenience initiate the same stress response that kept our ancestors alive. And what that does over time, even over a day, it's like turning a 3-minute roller coaster ride into an entire roller coaster for 10 hours. Our brains and our bodies were not meant for that. So when we do have our true struggles, there's little left, and there's little left to actually endure the struggle. It exacerbates all the real problems that we face. So take a look at the graph and just notice the red area representing stress. Take note of the positivity, performance, mental and physical stress representation around that stress. This represents an untrained human, untrained in VUCA scenarios. So what we do in this course is we help people train to endure pressure. And when you do that, when you learn how to endure pressure, you end up not only improving your performance, positivity, physical and mental health, but you can reverse the damage that has already been done. So now, this represents kind of a training model that we use, and I won't get into too many details of it, but there are some things that are really important to mention here. When you are teaching somebody, or whether you are learning, whether you're a parent or whether you're at work mentoring somebody, or you are learning a new skill, there's 4 things that if you think of these all the time, you will remove the fear of failure, which in the long run has catastrophic impacts on our mental health. And it's as simple as when you take a new skill, something that you're learning and or teaching, starting off with high level detail, and then going down into the weeds. That's the technical side. But the most important part is the empathetic side, the impact, where you see impact here. That means that you are teaching or learning the impact on yourself, but also the impact on others, how it is impacting those around you in construction, what is coming upstream, what is coming downstream. So it's a way of learning a new skill, but also teaching the empathetic part that flows outward into other people. When you can embrace this in your culture at your company, people tend to take a little bit more care in the things that they do. And embracing change or team cohesion at that level, again, has incredible long-term effects on positivity, performance, physical and mental health. Now the VUCA stage here, you're going to see some of the drills later on in this seminar. All this is you want to come up with drills or scenarios where you are applying pressure so the person can learn the skill in a scenario that's safe to fail. Same, just very simple. You make it simple for them to fail so they can learn and get over those failures, and they will emerge from the teachings a much stronger person, not just with the technical skill, but also overcoming the failures that are inevitable. Now the end state section is to make sure that if you are teaching or learning, you are dedicating the time, which is probably the biggest problem, the time for consistency and repetition. You can't learn complex skills just like that. You really got to dedicate the time and the consistency for it to stick. So this is just a simple model for people to follow, so they pay attention to the things that need attention, or that need attention, that require the attention to make sure that the skills stick. Okay, now we're going to get into some good stuff here. In our lifetime, we're going to run across a ton of competent people that are experts in their arena. That does not necessarily mean that they can perform under pressure. I'm going to show you this video of Michael Bay, one of Hollywood's best directors, stepping up on stage to give a presentation, and he's expecting a script, but then he has to wing it. Same thing as the guys saving Apollo 13 and that child trying to break the board. Onset of pressure, his limbic system kicks in, and watch what happens as one of the most talented directors in Hollywood suffers limbic transfer.
Ladies and gentlemen, director and producer Michael Bay. Good afternoon.
Thanks, Joe.
Good afternoon, Michael.
How is everyone today? My job as a director is I get to dream for a living.
Michael, you know, you're known for such unbelievable action. What inspires you? How do you come up with these unbelievable ideas?
I create visual worlds that are so beyond everyone's normal life experiences. And Hollywood is a place that creates a viewer escape. And what I try to do is, as a director, I try to... the type is all off, sorry, but I'll just wing this.
Tell us what you think.
Yeah, we'll wing it right now. I try to take people on an emotional ride, and
The curve? How does it? How do you think it's going to impact how viewers experience your movies?
Excuse me, I'm sorry. I'm sorry.
Okay.
Man, every time I see this,
ladies and gentlemen, let's thank Michael Bay for joining us.
It's embarrassing, but the point is you know, you do not rise to expectations, you fall to the level of your training. So just as some of the presenters mentioned before, our attention is being taken away from things that matter, and our time is being consumed. And it is resulting in a failure to give time to ourselves, to enable ourselves to perform at the level that is required for today's modern world. And you just witnessed it here. He's one of the most talented guys in the world in a certain arena, but because he's failed to put the time into himself, even he is or can be a victim of limbic transfer. Now I'm going to bring up one more video. It's an example that is something more mainstream that almost everybody can relate to. What you're going to see here is an untrained mom suffering the impact of limbic transfer, and Ann Coulter, a political respondent who is highly trained.
You keep saying, you know, statistics, but anybody can make up a statistic.
That's why there's so many of them, from both the left and from the right, and for 30 years
Where do you
now.
think it's okay to say all this?
Okay,
I mean,
you know what, you may as well stand up.
My mother was a single mom, and I'm getting like emotional.
That's fine. You're saying what you feel.
I can't talk now.
Yeah, go ahead.
Okay, you may as well stand up and say, I'm a smoker and I'm very upset about the smoking statistics, and don't you tell me about lung cancer. The statistics are the statistics. Be nice.
She's talking about something important to her.
So is smoking.
So she's a bully. And what's really important here, I mean, it may look like a simple video of a bully, but it goes a little bit deeper than that. It's important to realize this because we have either experienced it themselves or we have witnessed it. And when somebody is being bullied, the technical term is predatory aggression, where somebody is going in for the kill and creating a limbic transfer that's worse. It's important to recognize so you can help bring that person out. And limbic transfer is similar regardless of the scenario. This is an argument, but somebody might be in crisis, and when you can recognize the symptoms, you can help bring them out of crisis, out of their limbic system. Now, there's a ton of ways to do that, but the one way that I found is the best is a three-step process of breathing, calm tonality with your voice. A sense of calmness with your voice can have a massive impact. And the chase one rabbit is from an old Russian proverb. If you chase two rabbits, you catch neither. So in my experience as a police officer, a lot of times what I would do, bringing somebody out of crisis, is I would try and find one single focus. There might have been 10 issues that the person is focused on, and they might have gone on a rant for all 10 issues. And you would use what's called timed intervention. When the person is talking in crisis, they can't get a breath, but they will take a breath eventually, because you have to breathe when you talk. When you focus on one single issue repeatedly, you can eventually pull people out of crisis. Now, that seems so simple, but it's rarely done. And in my experience, I theorize that it comes from the fact that everybody defaults to motivation and inspirational conversations, which can hurt you. And I say that because I've witnessed people dealing in crisis, and at the beginning, they're doing a lot of the good things, which is being eyes and ears, listening, being observant, and giving the person the attention that they need. But what happens eventually is they start giving advice from a motivational, inspirational level, which is a huge mistake. And to make this point, 2 more videos. Let's watch this. This is from a movie. It's one of the most popular inspirational movies that is, inspirational scenes that is pulled from clips when leaders and speakers and coaches want to inspire and motivate a crowd. So you might recognize it. Oops.
On this team, we tear ourselves and everyone else around us to pieces for that inch. Yeah. We claw with our fingernails for that inch. Because we know when we add up all those inches, that's gonna make the fucking difference between winning and losing. Between living and dying. Now, what are you gonna do?
This may seem inspirational, and I use it to make the point where this is what most people do. And when they're dealing with somebody in crisis, or they're in crisis themselves, a lot of times they'll go to inspirational, motivational quotes, or if they're helping somebody, they will be that motivational, inspirational quote, which is okay, but it's grossly incomplete. I like the saying, navigation and discipline finish what inspiration and motivation start. So the inspiration and motivation is just to get you going. But if somebody is in limbic transfer, it actually keeps them in limbic transfer and they underperform immensely. So this next video is actually of a coach named Matt Arroyo in UFC. And the second half of it, it's a very short one. The second half of it is myself. It's audio because we can't use UFC footage. But you're going to hear us coaching a fighter at the highest level in the most VUCA scenario possible for this type of arena. And you're going to hear the coaching that is done at that level. And it's very similar to how you would handle a crisis with an individual, or how I did anyways as a police officer, and one that I found very effective.
Breathe, Matty. Take a drink when you need it. Breathe. Slow your breathing down. That's it. Slow it down. 6 + 4. Perfect. Matt, you won round 1, 10-9. The single leg is working for you. The double leg, he's sprawling nice.
Beautiful.
Sit down, baby.
Okay, sit down, breathe.
Breathe and relax.
Breathe, relax,
Breathe
take
and
a
relax.
break.
Breathe and relax.
7 + 3. 10. Excellent.
Good.
Excellent.
Breathe.
Listen to me. When the round starts, he's...
Breathe, Matty. Take a drink when you need it.
What you heard, obviously, the athletes know to breathe. And the proper way to breathe is 2 breaths in, 4 breaths out. It's a 2 to 4 ratio, just to slow the breathing down. That helps engage what's called the parasympathetic system. And you heard a math question in there. What we were doing as coaches is we were making sure that the athlete was in their cortex. Just a very simple check. You can't do math in your limbic system. So if you fail to get somebody into their cortex, if somebody's in crisis and you fail to get them into their cortex, everything that you're saying isn't being heard anyways. And a lot of the times they'll have auditory exclusion. They might hear things wrong, which means they might hear things wrong. So it's critical to make sure they're in their cortex first. So now, hold on a second. I'm just seeing some messages come here. Okay. All right. So what's really important is to make sure that they are in their cortex before you engage in instructions and trying to navigate them through their crisis. Now, let's get into some tactics. So one thing that we find extremely effective, and it's grossly underutilized, is journaling, note-taking. You can call it notepadding. And this level of documentation can help you in so many ways, but it's very rarely done because people don't necessarily see the value of it. So I want to give you 3 scenarios where there is immense value. One is insomnia. So insomnia, for our ancestors, this was the gift of life. Again, our brain was designed in ancient times. But today, we're worrying about all those things, when all the things that happen throughout the day, or our intelligence is so good that we are able to look ahead in the future and think of scenarios that might not even happen. And we're so good at it that it increases anxiety. So we are being bombarded by stressors that increase anxiety, both in reality and in an imaginative world that we fictionalize. And our ancestors, they suffered anxiety, but for good reasons, because it was keeping them up at night. It was the gift of life, where they were able to protect their tribe from any prey, from any hunters that were coming in to either steal their food or hunt them. So now, when we worry about things, insomnia kicks in, thinking that it's keeping us alive, and all it's doing is depleting our sleep and preventing us from being more capable of enduring the regular stressors and having the cognitive energy to endure the struggles that we have to endure in our regular everyday lives. Now, a great way to get over this is simply having that notepad beside the bed, and it's like you write down your fears, your anxieties, anything that you're worrying about, and close the book. And that's a really effective way at kind of hacking your brain so you can try and get some sleep. Now, anxiety, when it's related to anxiety, journaling your fears and anxieties is a great way to have documented evidence that shows the cycle of it, where you are on that roller coaster and there is the ups and the downs. And the one thing that it helps elucidate is that you will be okay. Now, when you see a degradation in the evidence, when you look back and you can see that clear decline in your struggles and your ability to overcome the struggles, that is your trigger, should be your trigger to get help. Now, when you do find that path to professionals, the crisis resolution part, this is where the evidence becomes invaluable. When you do see that professional, that documented evidence of your journaling is invaluable to the professionals and assists them in helping you get through your day, period. So it is very difficult when you are going through your struggles to recall everything at a level that the professionals can really benefit from, or prepare the best resolution for you. So highly underutilized talent or highly underutilized tactic. Now, a lot of the times, we're coming up to the end here. Okay. We've got a lot to cover here, a little bit behind here, but one of the main reasons that anxieties and struggles are exacerbated is time and attention. Now, a really effective tactic that I found to overcome this is don't task it, calendar it. Very simple. And what that means is a lot of times when people get bombarded and they feel like they've lost time in their day, they'll create task lists because they get behind. But the task lists never get complete. And it's because they lack the time element to it. So putting every single thing that you do in your calendar, you will see the whole calendar fill up. And then that's when it'll be painfully obvious that a major source of your stress is the fact that you are not accounting for everything properly with your time. So, anyways, it looks like we're coming into the end here. I didn't get through everything that I wanted, but what I'm going to do is I'm going to wrap up this presentation and package everything together and make it available to the entire group. I'll finish it off too with a little bit of a recording because there's some really important messages further on in the presentation. Now, just to wrap up this part, putting everything in your calendar, the most important part is the fact that it'll make you realize that you are always saying no to something. And when you put everything in your calendar, the whole purpose of it is A, to realize that you don't have the time there. So now you get to take control of what you say no to. So the feeling of time and control helps you lower the anxiety that you have on a regular daily basis. So again, everybody, I'm sorry I wasn't able to get through all of the content, but like I said, I'm going to finish some of this in a recording, package it all up for you, because we are going to finish off with some really good tactics that can help you in your daily life. So we cannot control the VUCA world, but what we can do is prepare and repair for it. So I like to look at things from a VUCA world. It's like a hurricane. Mental health is like a hurricane. You can't stop it. But if you prepare and repair after, we've all got a chance. Okay, so thank you, everybody. I'll turn it over to Amina now.
Thank you, Chad, and sorry we couldn't get to your the rest of your presentation.
I know.
We're very appreciative that you're willing to share the rest of it with us.
I will. I'll. Okay, this will start. Can you continue? Okay. Let me clear this off. Excellent.
Perfect. Thank you. Yeah, and so I'll kick it over to Andrew to deliver some closing remarks. And just again, thank you, Chad and Cal and Ron and the Minister Tabol for participating in today's event. And I'll kick it over to Andrew now.
Yeah, thank you. Thank you very much, Amina. I guess just to do some closing remarks, I can't believe that it's already been a year since our first one. And the theme of our first one was really focused on the importance of mental health. And I think this group was offered a lot of congratulations, saying it's great to see the construction industry taking it in as an important issue, which it is. And after that, we went back to the RESCON Health and Safety Committee. And the discussion was, okay, we all realize it's important, but we really need to be doing something about it. And so I think my first thank you is for Amina Dib, because Amina really took the task on of organizing this webinar and figuring out how to get speakers and people involved that would really focus on, let's do something about it. And so today's focus on data and the practical solutions that were offered, I do have to give a big thank you and kudos to Amina, who really did organize this entire webinar. Thank you again to Ron Koleski, the CPO, and Minister Michael Tabolo. The government commitment, I think we saw it last year, and we've seen that commitment grow over the last year. This is an issue that's not going to go away, but we are confident in the partnership that we have. And one thing that I jotted down was really what Ron said, which is, what does the construction industry need from us going forward, and how information can be passed out? And so I think, we've got a health and safety meeting on Tuesday at RESCON. We're going to specifically ask that question, but for everybody who's on this webinar, if you've got some ideas, don't hesitate to get into touch with us. A big thank you to the speakers, Cal and Chad. Amina found both of you, and she really found experts from a data point of view, from what Cal was able to offer, how you made it personal, and the poll questions I found were amazing. From Chad, I've never seen a presentation like that, and I hope to see how you're going to round it out. I thought it was very impactful. I think when we can understand what's going on in the brain, it helps us adapt and make the changes that we need to. As we normally do with webinars and events, in lieu of gifts, we often make a donation. And so we are going to make a donation to CAMH, who is, amongst the mental health leaders in Canada and partners with a lot of people throughout Canada, including our industry. As final thoughts, and I will turn it back to Amina, I kind of took today as a bit of a call of action. We know what we need to do. We know that this is a big issue, and we know that it's not going away. We've got government partners that want to work with us. We've got health and safety associations, including the IHSA, that are making mental health more and more of a priority. We've got labor partners, whether it's 183 or the building trades, that are willing to work there. These are union members who work on our sites. It's also our employees. It's our brothers, our sisters, our nieces, our nephews, our uncles, our aunts. The construction industry is really a mirror of society. And I guess when it comes to suicide, we saw this is an area that construction's impacted more. And so now that we've got the information, we need to do more and more with it. So I guess looking forward, we are certainly going to have another event in November, but I think the idea is to not just have an annual event every November. It's also ways to figure out and do meaningful actions between now and November. But thank you to everyone who participated. You know how to get a hold of us, so please don't be shy, and I will turn it back to Amina as well.
Thank you, everyone. Thanks to the speakers, and we'll be following up with the attendees with some of the slide decks and more resources. So stay tuned. Thank you.
Bye, everyone.